Hey there, it's Saturday, March the 28th. The holy Johns Hopkins case counter stands at 662,000. Globally, we've cracked 30,000 deaths, but also 139,000 folks totally recovered. This is the Apocalypse Prep COVID-19 rundown. My name's Mitch Stripling, and today we're going to talk about something that hasn't been talked about as much in this scenario so far, which is small towns. Okay, I keep trying this. It keeps dying, so I don't have a lot of confidence in it right now. So that's the reason I'm not doing my usual spiel. I'm just gonna see if it's working. Just sending a little push out there in the internet. Hello, internet. Can you hear me? All right, I'm gonna try my opening one more time, and we're gonna see if it sticks this time. And if it doesn't, you guys are my friends, so you'll support me through this. Um, It's Saturday, March the 28th. The holy Johns Hopkins case counter has cracked 662,000. We've hit 30,000 deaths for the first time, but also 139,000 recoveries, which is a reminder that most people are going to get this virus and they're going to self-resolve. So let's stick with that and not fall into all the hype from the media reporting. Today, we're going to talk about small towns and cities around the country and why this could turn out worse for them than we're thinking so far, and what they should be doing to help on our Apocalypse Prep COVID-19 rundown. It's important to always travel with theme music. My name is Mitch Stripling, and I'm an emergency manager in Brooklyn. I focus on public health issues, but I'm not a doctor, so I cannot do doctory stuff like diagnose. What I can do is talk about what's happening in this country, what's happening with this virus, and hopefully give you some sense from a society perspective what to do about it, and answer some questions. So if you've got questions, queue them up in the chat. I'm hoping this is streaming out there now, so somebody flag me if it is, and let me do a news rundown before I sort of dive into our deep topic. So today, we did pass 2,000 deaths in the United States. Want to note that the number of cases is much, much higher than that. The number of recoveries is also much, much higher than that. Sweden is seeing its first cases, but is not locking down. Denmark has decided to cover all of its worker salaries during this, which I think is a big step towards equity. I'm applauding that. We did have 7 FEMA workers test positive. Here in New York City, 2 MTA employees died of the virus. So we're hitting the point now where people are gonna know friends and family that are infected in different ways. So what are we going to talk about? First, I'm going to do a little bit of an awkward check just to make sure this is working. So stick with me. All right, I think it is. Using a new system, couldn't figure out the old one, so we're just going to go with that. Okay. Here's what I want to talk about. So far, most of the coverage of this coronavirus has been focused on big cities, whether that is Wuhan in China, cities in Italy. We've talked about Seattle. We've talked about New York City. And there are reasons for that, right? Cities are highly dense because they are likely to see more illness. And because of that, they become epicenters and they get a lot of press and coverage. New York City is facing a tragedy right now. It is facing surging beds in healthcare facilities. It's facing a lack of PPE. I'm not in any way diminishing that, but I can also tell you that New York City has the finest public health and healthcare infrastructure in the country. And that infrastructure has been focused on this for months. They've been working on beds and ventilators and how to support the population in terms of policy and financially and emotionally, and sort of this whole constellation of support. And what's going to happen now is that you're going to start seeing disease hit in places like, and I'm reading this from some New York Times reporting about sort of case counts per population in Pittsfield or in Bridgeport or in parts of Detroit or places like Kingston, New York, or Show Low, Arizona, or right near my hometown, Albany, Georgia. And these are places that are smaller. they have this lack of density. So from the okay, that's good. It's going to be easier for them to hunker down and shelter in place. But there's some problems with that. And this is where I drink the whiskey, right? And some of those problems have to do with underlying illness in the population. Because of that underlying illness in the population, whether that's higher rates of diabetes, heart problems, lung problems, those areas of the country might see higher levels of illness. And a lot of that is because many of these places have underfunded their public health infrastructure. They actually have fewer health clinics than they did, fewer hospitals, fewer doctors than they did a decade ago. And that's gonna cause a problem. There's a lack of trust in government in some of these areas that we've seen from different reporting over time, and that means that fewer people might listen to the government's advice to socially distance from each other. That's a problem. There's less redundancy in essential services. So when you see these orders go out that say, "Okay, everybody stay home except grocery store workers," right? Except people that work in primary care clinics, except delivery people. What if you're in a place that only has 3 or 4 grocers? And if they're hit with an outbreak, you're suddenly faced with a situation where you have a lack of that essential service wholesale in the area. And this all goes back to one other thing. In the last decade, we've already also seen a lot of these places get hit by a lack of local news, right? There used to be sort of more local newspapers, local news channels, and those things have either been centralized or they've gone bankrupt. And so you don't have that information stream anymore, which is something you really need. Thanks for the glasses compliment. Loving that. They don't make these anymore. They're Warby Parker and they're gone now. So let's all shed a tear. But let's shed more of a tear for the fact that looking at these smaller towns and cities, you've got these things that are all coming together that could really cause a tsunami of devastation, higher illness rates, higher fatality rates in these areas. So I'm just going to run them through again. This higher level of underlying illness. We see in a lot of these places a lack of public health infrastructure because it's been decimated over time. You have less redundancy in essential services. So you have fewer grocery stores, you have fewer delivery systems, and you have a lack of trust in government, and you have a lack of local news. Put all those things together, and you have a situation where it is going to be much harder for these places to respond. And I feel this strongly because I'm looking at my family around Albany, Georgia, and looking at the impact of the outbreak that's happening there. And they're a weekend, and they're already out of ICU beds. Right. And so they're already starting to funnel patients sometimes 30, 40, 50 miles away to other hospitals. And that is going to cause cascading effects that's going to end up causing more mortality in the outbreak. So I'm really worried. As a public health person looking at this country, I have hope for New York City, although it's going to go through this terrible tragedy because there are all of these great people working on it. I am so worried about these smaller towns and mid-sized cities out there who are going to maybe get caught off guard, who are not going to have enough time to get planning in place, and that is going to lead to a lot of unexpected deaths in places that think the virus is coming slowly, but where it is really going to come fast. So that's my dose of bleakness starting this off. So I'm just going to drink a little more whiskey and think about what to do about it. And as I'm doing this, feel free to pop questions into the chat. So we have these places, smaller cities that maybe are less prepared and have fewer resources. What happened this week was Pete Gaynor, who's the administrator for FEMA, did something unique. He sent a letter out to every working emergency manager in the country, asking them to take sort of a top 10 set of actions that they needed. Every community, large or small, needed to take those actions. And some of those line up a lot with what I would say to you right now. If you're in a suburb, a smaller city, a mid-sized city, and you haven't seen the level of kind of preparedness that you want to see in the city, there are certain things that you need to sort of do yourself, and there are certain things that you need to push your town or city to do. So number one, you want to make sure that you have a clear stay-home order in place. This messaging has been messy. People are using big sciencey words like social distancing, and I do not think that the majority of populations are understanding this. especially populations who are not like reading the New York Times every day, right? Who no longer have a local newspaper to depend on. Your town should get together and issue its own stay home order for the population, even if it's not legally binding. My parents' town, Camilla, just did this. It was great. There were a lot of whereases in there, sounded really official. And that's something that really helps people to take it seriously who know you. Second, you've got to make sure that you have community support in place for essential workers, especially if you're in a place that only has one or two grocery stores within 20 or 30 miles, and people who are sort of isolated and shut in can't afford to travel more than that. So are there ways that you can connect virtually with other people in your town through Nextdoor, through through Facebook, other places like that, that you can get together to figure out who can reach out to the grocery store owner, who can help with the delivery of goods, especially if you're younger, you don't have underlying medical conditions. These are really important things you can do to help your community now, because we're seeing in New York City at this point, we're maybe like a week and a half in your future. And even here, there are illnesses that are shocking the system. Now, we have a lot of redundancy, and so we're going to be able to sustain that. But if you're in a community that doesn't have that, it can cause real problems. All right. So the next thing is healthcare. So looking at healthcare, most hospitals already know this is coming, and there's been amazing planning in the hospital community for things like ventilators and making deals with other hospitals. But what you should know is that here's the way this will go down. The hospital will start seeing cases. It will fill up. The hospital bed will fill up. Its ICU beds are going to fill up. And then it's going to start routing patients to other hospitals. And there's some cascading impacts to that. First, it means that if you have underlying medical conditions, it's going to be harder for you to get seen at your local hospital for other conditions if it's not COVID. Also, primary care clinics are also going to be overwhelmed with COVID patients. So what we're seeing in some localities is clinics are deciding that they're either a respiratory illness clinic that's going to screen for COVID, or they're a clinic that's going to look at other things like knee injuries, broken arms, that kind of stuff, or they're going to alternate hours. And what that's going to do is it's going to cut down on care opportunities. So even if you're a small town, it is a good time to gather the doctors in your community, make sure that any retired doctors in the area are willing to come out to help, especially if somebody gets sick. And to start thinking about alternate care sites. Imagine a situation where you break your leg and the two closest hospitals are full of COVID patients and it's hard to get in there. A leg break isn't the best example because urgent cares can handle all of that. But something like a kidney failure or a diabetic incident, something that needs hospital care that isn't COVID, it's harder and harder to do that triage the more these beds get filled up. So by having these conversations between doctors now, you can sort of get ready for that later. So the next thing is you want to make sure that you've got some kind of reputable news sources happening. This can be a giant Facebook group of people in the community that are connected. It can be via church networks or faith-based networks. But the tricky part of it is people tend to think they can Netflix and chill through this emergency, right? And the thing is that actually almost a majority of people in a given community don't have the resources to do that. They're facing a situation where they are more and more cut off from news because they're isolated in their homes and they don't sort of have the resources to do that. And they're worried sort of about their economic future. So you have to work on getting communications outside of your bubble through the other networks in your community. So a good way to do that is through the legal authorities in your community. Some places the police are doing drive-arounds to do information. Sometimes you've got still morning radio, local shows, that kind of thing. Business networks are good ways to do it. But you want to make sure that there are ways to get the news out because people think everybody knows this, but they still really don't. I mean, they've heard the headlines, but they don't necessarily know what to do to keep themselves safe. And they also don't know what to do if they have symptoms. People are still flooding and looking for tests when it's much better right now to sort of stay home and ride it out. And here's the last thing. So this is my fifth thing. You really want to think about transportation networks. So this is hard. In the city, we're hearing more sirens these days because people are calling for ambulances. And it's because the way COVID is you will hit a respiratory place where you have a shortness of breath, and then people get really worried about it and they want to get treatment. And that's right. That's what the guidance is. But if you're in a situation where your nearest hospital is 40 miles away or something like that, and that hospital is maybe not seeing respiratory illness patients because they've run out of ICU beds, you're in a fix. Now, I'm not saying that hospital isn't going to triage you and help you transport, because hospitals are doing amazing, miraculous work doing it. But I'm saying is that if you don't have an easy way to transport yourself that far, you're facing a problem. So it is worthwhile doing two things: making sure that your city has good connection points with transportation networks. At a base level, make sure that you've got family or friends who can drive you if you're ill, and that you're willing to do that for family and friends so that you have that set up. And second, you want to make sure that your community is thinking about alternate care sites, either to care for lower acuity patients who aren't doing that well but might want to see a doctor, but maybe the doctor's hours are different, right? You want to make sure people know that. And also how your community will handle people with these other kinds of medical illnesses that aren't COVID. So it might be a small thing. It might be that you set up an emergency clinic or emergency hotline or those sorts of things. But in mid-sized cities or towns, these are things that people can affect themselves. It's not big government. It's not like senators walking around in ties, drinking their fancy cocktails, right? It's things that you can do by calling your mayor, calling your local representative to get you guys set up. So I'm going to run through those 5 steps one more time. Coming in for the chat. I'm going to run them through, and then I'm going to kind of re-hit my thesis, because I'm learning Facebook Live. You've got to kind of re-hit the main points over and over again. The problem I'm talking about is that smaller towns and mid-sized cities are going to get hit by a wave suddenly in New York, but I think still in smaller towns there's an aura of, well, this is still a few weeks away. It's growing slowly, but we've got time. And the fact is, the way the growth works, you don't have time. And because of the underlying illnesses, the lack of public health infrastructure, the lack of reputable news sources in some of these mid-sized cities where people have sort of defunded health and healthcare, you're going to have a problem real soon. So I'm advocating you do 5 things. First, you make sure that there are clear local stay-at-home orders in your town, not with big sciencey language about social distancing and epidemiology, but just stay home, only go out for essential services. And that should be coupled with something the town's going to do to support people, right? Can we surge up food delivery? Can we make sure that people who are losing jobs that have GoFundMes or whatever it is to support them? Second, you want to make sure that your healthcare system is thinking about redundancy. Now, usually hospitals are on top of this, right? They're rocking and rolling. I'm talking about looking at the primary care clinics in your town, how you're going to make sure somebody gets care who's a neighbor or in your city if they need to primary care for other reasons. Third, you want to make sure you've got community support to build in redundancy for essential service workers. If you only have a few grocery stores or delivery people, how do you help them? Are there volunteer services you can stand up? Are there business partnerships that could be put in place to make sure that if one grocery store owner gets sick and you have an outbreak and you should close a store, suddenly people don't lose access to food? Fourth, you want to make sure there's reputable news going around, that news sources are spreading out, not just in your bubble, but throughout the community. You can reach out to your local representatives to help with that. And finally, this is a situation where as more hospitals fill up their ICU beds, then there might be issues with transportation to care. So you want to make sure your area really nearby has established alternate care sites or places to triage for COVID or to see other patients, for other things. That's part of the issue. Is it's not like all the other medical conditions go away so people can treat COVID. You want to make sure you can handle all of it. So you want alternate care sites in your neighborhood, and you need to make sure that you're clear on how you and family and friends and other vulnerable people in your community especially will get transportation to wherever they need to for COVID care if hospital surge is making it harder, right? You want to make sure there's a triage site or a clinic. You understand what the hours are for primary care and all that other stuff. So, that was a whirlwind. I feel like I monologued at you. I did, in fact, monologue at you that whole time. So if you've got questions you want me to hit, pop them in the chat. I'm going to drink another whiskey and I'm going to run through the list. Here's my favorite question. Is this the test or the live stream? This is actually the live stream, because if it were still the test, I would have really wasted a lot of good words on the test. Whew. But my mics keep breaking, and that's been a problem. All right. So do I feel that the country is underprepared? So I do. I think that, as a public health emergency specialist that has worked in this for a while, it has been very difficult to convince political leadership in this country of both parties that large-scale social distancing was ever going to be a thing. People just believed it wasn't possible. I mean, I imagine most people listening to this believed it wasn't possible like 2 months ago. But it's been something that's been studied for a long time, but no politician has wanted to touch it. And so that's meant that even though hospital systems, healthcare workers, public health have done amazing work getting us ready for this, that kind of lack of political leadership has hurt that. Oh, look at that. That's like all the questions I've got. So that makes that easy. I hope this was helpful. I'm going to do a little song and dance here, because sometimes I do a little song and dance and somebody else asks a question. So hold on 1 second. It's nice because on my breaks I can just drink whiskey. Okay. Well, I'm not going to belabor this. Here's what I'm hoping. I'm hoping you find this helpful. I'm hoping if you live in a town or a mid-sized city, you know what you can do, and you know that this is going to come to your smaller and mid-sized cities. Oh, look at that. I'm getting a question here. Updated Mitch predictions for how long to hunker down. That's a fun one. See, I have a new button to show these on screen now, right? So there's new modeling from Harvard, and everybody always loves Harvard modeling, right? It's like that's the classic modeling, is Harvard modeling. That shows that here's the problem. Part of the problem is we're not doing this consistently around the country, right? The country sort of didn't say, okay, everybody, we're going to stop altogether. And because of that patchwork approach, it means that this thing is going to sputter out in some places, and then it's going to start up in other places, and it's going to kind of sputter around the country. That's the problem. And so that's going to mean that it is going to take longer to hunker down, and that the economic fallout is going to be worse, right? The way you want to do this is once and cleanly. You want to say to the country, everybody, I know this, it sucks and it's hard to believe. We all have to social distance for 8 weeks all together at once. We're going to work on these aid packages, and then you have sort of a more clean reboot. We're not going to have that in this case. And so it is likely what the modeling shows, which may or may not be right? Modeling's always wrong, is that we have something like, what is it? April, May, 8 weeks, 8 to 10 weeks like this. While we watch the curve go up and then down across the country. It's happening faster in New York City than people thought it was going to, right? It's coming more quickly. And that's going to happen in other places too. Places that last week had 4 cases, today have 50 cases. And it's going to keep happening like that. So you're going to have to wait for it to go up and then go down below a certain infection threshold. So 8 weeks. Now, here's the problem, Brian and others, which is that when you're doing this social distancing, you're not creating herd immunity in the population. You're not sort of protecting people. Like you get the flu, you survive the flu, then you are immune from the flu. You don't get that with social distancing. And so the issue is that once you release these restrictions, everybody goes out into the world again, then you're going to start to see the virus tick up again. So what a lot of the modeling is saying is that you're going to see this roller coaster of social distancing where you're going to see more cases, you're going to have to lock the country down, and then you're going to see more cases and you're going to go around and around. Now, there are a couple of things that are coming down the pike that might change that. Thing one is new therapies. There are antivirals that are being tested. People are like snorting antimalarial drugs like they were cocaine, right? There aren't there's not data on that, but people are working on therapies. The more therapies you have, the less scary this is, the easier it is to go back to regular life. The other thing is personal protective equipment. If healthcare workers had enough masks and gloves, if you weren't seeing these shortages, it would be a lot less scary for the healthcare system, and that would help them to provide better care, and that would make it less scary too. So the idea is, and I'll do another one of these focused on this. The point of social distancing isn't actually to stop you from getting the disease. It's to show solidarity with the most vulnerable. And also it's to buy time, right? It's to give the country 8 or 10 weeks to innovate and design new strategies and get to the point where next wave, we don't have to do this again. That's what we should be doing, is using our entire brain trust of the country to focus and make sure that the country doesn't have to go through this again. I don't know that that's what's happening. I'm not in those rooms, but that's what should be happening, is let's surge testing, let's surge containment, so that when the next wave hits, because the next wave will hit, we can do a different set of strategies than what we're doing right now. So that's my prediction. At least that's Harvard's prediction. My prediction really only goes in the next 24 hours and is mostly about whether the kids will kill each other or not. That's basically as far ahead as I'm thinking right now. Whew. Okay. Was that a bleak note to end on? It's good because we're all here and we're safe and we've got enough food and we've got good friends that we're talking to and all that. So I'm gonna jump off because one of my daughters has a virtual party that she's gonna go to, and I don't want to seize the bandwidth from her because, social distancing altogether means that we have to share important things like bandwidth. So thank you all very much for joining with me. I hope these things are helpful. Feel free to send them around and share them. I'm just trying to get the word out here, and take care. And wherever you are, wherever you may be, have a good night. Be safe.